Now, after understanding the principle of galvanometer, this is the third video of ECG series, that is how to actually get the electrical activity in electrocardiogram. So, this is our heart. This is our heart. So it has two atrium and two ventricle. So if we see this heart in 3D plane, so this is the vertical plane. These are the vertical plane, or horizontal plus horizontal plane. That is the 2D one plane, and another one is this is the coronal plane on coronal plane. So this is the vertical or horizontal, vertical plus horizontal. This is coronal. To see this electrical activity in a heart, we have to place the lead. This means electrode of our ECG. So to detect the vertical plane electrical activity or frontal plane electrical activity, we use limb leads. We use limb leads. So the limb leads are two types. One is bipolar, another is unipolar. So we have three bipolar and three unipolar limb leads. 1, 2, 3. AVF, AVR, AVL. So the bipolar lead measure electrical difference between 2 points or between two limbs. Measure electrical difference between two limbs. The point which is connected to the positive pole, is called exploring electrode, and it detects the direction of electrical vector. The negative pole is the reference electrode, and the tail of electrical vector is shown by negative pole. So if we see now, this is our heart, and this is right upper limb, left upper limb, left lower limb points. So positive points connected, negative point connected with positive point, so this vector is directed towards negative to positive, right upper limb to left upper limb, then right upper limb to left lower limb, another lead is present, and left upper limb to left lower limb, another lead is present. This lead is called lead 1, this lead is called lead 2, this lead is called lead 3. So if we see the atrial depolarization or the net atrial depolarization vector, that will be directed like this. So it will be parallel to the lead 2. So the lead 2 will show the maximum deflection, and that will show the deflection of atrial depolarization, that is P wave. We have already seen in our basic part 1 video. So lead 2 will be the best lead to analyze P wave. In lead 3 there will be slightly positive deflection. In lead 3 there will be slightly positive deflection, as well as in lead 1 there will be slightly positive deflection of the P wave. Next come the unipolar limb leads. Unipolar limb leads, it measures the electrical activity difference between one limb which is connected to the positive pole and combination of 2 points which are connected negative pole. Those 2 points is those another 2 limb. So like this, if this is the heart, this is right upper limb, this is left upper limb, this is left lower limb. This is the galvanometer positive pole, this is the negative pole. So right upper limb is connected to the positive pole and left upper limb is connected to the negative pole, and left lower limb is also connected to the negative pole. So this is the direction of the actual vector from negative to positive. This is called AVR, augmented right upper limb unipolar limb lead. Like this there are two another lead, those are AVF and AVL. So if we see the atrial depolarization, this is the net atrial depolarization. In AVR, if we see the direction of the atrial depolarization vector is from positive towards the negative. So there will be negative P wave in AVR electrode. The atrial depolarization vector, that is directed from positive to negative part, so this produces a negative deflection of P wave on AVR. It produces positive deflection in AVF, also positive deflection is AVL electrode, positive deflection in AVL electrode. So in unipolar limb lead, AVR limb exploring electrode is right upper limb, reference electrode are left lower limb and left upper limb. In AVRL, the exploring electrode is left upper limb, the reference electrode are right upper limb plus left lower limb. In AVF, exploring electrode is left lower limb, reference electrode is right upper limb plus left upper limb. So these two are unipolar leads, these three are unipolar leads. Then to detect the horizontal electrical activity, we use chest lead. So there are 6 chest lead, that is unipolar, from V1 to V6. Their placement is like this. This is the sternum, these are the ribs, and these are the intercostal area. This is 4th intercostal segment, this is 5th intercostal segment or intercostal area. This is the right side, this is the left side. So just right side to the sternum, this is V1 in the 4th intercostal phase, this is V2. At the mid clavicular line MCL, we have V4. In between V2 and V4 at the 5th intercostal phase, we have V3. At anterior axillary line, we have V5. At mid axillary line, we have V6. So V1, V2, V3, V4, V5, V6. These are the chest lead which measure the electrical activity in horizontal plane as well as in coronal plane. Thank you.